Bismillahirrahmanirrahim. Assalamu alaikum. My name is Dr. Mohammed Zulqarnain Chaudhry, and I am a consultant breast surgeon at Shaukat Khanum Memorial Cancer Hospital in Pakistan. Today I am going to talk about symptoms of breast cancer. The incidence of breast cancer is very high in Pakistan. Rather, it is highest in Southeast Asia. One in every 9 patients have breast cancer. That makes it 10 in every 90 patients, or 11 in every 100 patients. What is the cause of this high incidence is we are going to discuss in the next program. Today we will discuss the symptoms of breast cancer. And I think which is very important for most of the patients, especially women in Pakistan, to know what actually are the symptoms of breast cancer. So the first symptom, which is the commonest symptom, is a lump in the breast. So the commonest symptom of breast cancer is a lump in one breast or in both the breasts. This lump may be present in any quadrant of the breast or beneath the nipple areola complex. This lump can be small, about the size of a big almond, or as big as a cricket ball. Most of the lumps are small to start with, and gradually they increase in size. Research shows that it takes about 40 months for one cancer cell to become 1 centimeter lump, which is roughly 3 years. And from 1 centimeter to 2 centimeter, it takes 6 months to 18 months. So by the time the lump is identified, the cancer cells may have been there for quite some time. And some authors state that by the time breast cancers are diagnosed, cancer cells have already been shed into the body circulation. So the second symptom is pain. Breast cancer lumps are generally painless. Pain is a very unusual symptom of breast cancer. Breast cancer lumps are generally painless, and rarely when they get very big or they involve the local tissue, they become painful. But in general, we may say that painless lumps in the breast is the commonest symptom of breast cancer. Changes in skin. Normally, the skin overlying the breast tissue is very even and smooth. There are no wrinkles, depressions, or puckering of skin. Any of the above symptoms, that is, a depression, puckering, ulceration, or thickening of skin, is a symptom of breast cancer. Sometimes the skin appears as a peel of orange, which is also a symptom of cancer, which has a specific name, which is called peau d'orange. Third symptom is the shape and size of the nipple. Nipple inversion or pulling in of the nipple is a common symptom of breast cancers, which are lying under or beneath the nipple areola complex area. At times, the nipple get very swollen or ulcerated, and the worrying symptom is when ulceration begins from nipple and spreads out into the areola. The nipple gets destroyed gradually, and later stages it is fully eroded. This condition is called Paget's disease of nipple, which is one type of the cancer of breast. Fifth symptom is a bloody discharge from the nipple. A spontaneous, continuous bloody discharge from nipple can be a symptom of breast cancer. It is associated with or without a lump in the breast. It comes out from either a single duct or which a single duct which appears as a single dot of blood discharging on the tip of the nipple, or from many ducts. At times it stains the undergarments, and usually it comes out itself without any squeezing or pulling or putting a pressure on the nipple areola complex. So any spontaneous discharge for more than 2 weeks, and which is spontaneous, can be a symptom of breast cancer. One of the other symptoms which we usually come across are lumps in the axilla or above the collarbone. Cancer cells that travel from breast to glands in the armpit. From there, they can travel to the glands either below or above the collarbone. It is difficult to examine clinically the glands below the collarbone, but the enlarged glands above the collarbone can easily be examined on a clinical examination. So, cancer cells which migrate to lymph glands in the armpit or above the collarbone can enlarge the glands, which become easily palpable, and this is also one of the early symptoms of the breast cancer. I can discuss some late symptoms of breast cancer, which can appear as uh, uh, basically the late symptoms. They occur when the breast cancer cells spread from the breast tissue involving the different other tissues away from the breast like bones, lungs, liver, and brain. Symptoms can appear late in disease which are related to the involvement of these tissues. So, patients can complain of bone pains, breathlessness, or cough symptoms, weight loss, jaundice, dizziness, and headache. So, we conclude our first episode of symptoms of breast cancer.